What if I told you that every single bunion and hammertoe surgery I perform is without general anesthesia, without an IV, and without putting patients to sleep? In fact, my patients eat breakfast the morning of surgery, stay in their own clothes, and walk out of the office the very same day. Today, I'm going to explain why I only use local anesthesia and why most patients actually prefer it that way. I'm Dr. Lance Reeves with Cool Springs Foot Care in Franklin, Tennessee. One of the most common questions I hear from patients considering surgery is, "Doctor, will I be put to sleep for this?" And the answer surprises a lot of people. For my minimally invasive bunion and hammertoe surgeries, the answer is always no. I perform these surgeries using only local anesthesia. In this video, I'm going to explain what local anesthesia means, why patients can avoid general anesthesia, the benefits of avoiding IVs and intubation, why surgery can be performed in the office, and what I do for patients who feel anxious. And make sure you stay until the end, because I'm going to explain why patients tell me the anesthesia experience was actually easier than the surgery itself. Let's start with the basics. Local anesthesia means I numb up only the specific area of the foot that I'm operating on. The rest of your body is unaffected. You are not put to sleep, and you are not unconscious. You are comfortable, relaxed, and the surgical area is completely numb. For my patients, that's a completely different experience than what they expected when they first started researching bunion and hammertoe surgery. And one of the first benefits starts before surgery even begins. If you've ever had surgery under general anesthesia, you've probably heard the instructions, nothing to eat, nothing to drink after midnight. And for a lot of people, that means going most of the day without food and water. If your surgery isn't until late morning or early afternoon, that's a really long time to wait. With local anesthesia, patients can eat and drink normally the day of surgery. Many of my patients enjoy breakfast and a coffee before coming into the office. That may sound like a small thing, but it makes the entire experience much more comfortable. But that's not the only thing patients avoid. One of the biggest fears some patients have isn't actually the surgery, it's the IV in their arm. Most people you talk to don't want a needle in their arm. Others worry about how anesthesia medications will make them feel. Because I use local anesthesia, there is no IV, no sedation, no anesthesia medications flowing through your bloodstream. For patients who have anxiety about anesthesia, that's often a huge relief. With general anesthesia, patients are intubated during the procedure. This can sometimes lead to a sore throat, hoarseness, or irritation after the surgery. With local anesthesia, none of that is necessary. No breathing tube, no throat discomfort, no recovery from intubation. And this next benefit is something many patients don't think about until after they've experienced it. If you've ever had general anesthesia before, you may remember the recovery room. Some patients are waking up feeling groggy, tired, nauseated, or disoriented. Others simply don't like the feeling of coming out of anesthesia. With local anesthesia, there is no waking up period. Because you're awake throughout the procedure, once surgery is complete, you simply move on with your recovery. Many patients tell me they appreciate how smooth and straightforward that feels. Another thing that surprises patients is that I do not use a tourniquet during these minimally invasive procedures. A tourniquet is a device used to temporarily restrict blood flow during surgery. Now, tourniquets are valuable tools in the right situations, but for minimally invasive bunion and hammertoe surgery, they just aren't needed. That means that surgery can be performed without intentionally restricting circulation to the foot. And here's a benefit that many patients almost never think about beforehand. This may seem minor, but many patients really appreciate it. In a hospital or surgery center setting, patients typically have to change into a hospital gown, you're surrounded by unfamiliar people, you're in an unfamiliar environment, and for a lot of folks, that just feels uncomfortable. Because this surgery is performed in my office under local anesthesia, patients remain in their clothes the whole time. It's a small detail, but small details often make a big difference in how comfortable patients feel. Because there is no general anesthesia, there is no need for a hospital or surgery center, and that creates several benefits. One of the biggest is predictability. In the hospital setting, surgeries can often be delayed because of emergency trauma cases, staffing shortages, scheduling changes, or unexpected emergencies. If a trauma comes through the emergency room, your surgery may get pushed back and delayed. In my office, that never happens. Your procedure is the primary focus of the day, and when you're here, you're receiving my and my staff's full attention. But what if you're a little nervous about being awake during surgery? Let's talk through that. Some patients are completely comfortable with local anesthesia. Others feel anxious about the idea of surgery and being awake. For those patients, I prescribe a mild anti-anxiety medication. It's similar to what some people take for flying, MRIs, and dental procedures. It's to simply help you relax and take that edge off. Many patients find that it makes the experience much more comfortable. The reason local anesthesia is possible is because of the technique I use. This minimally invasive procedure involves tiny 2 to 3 millimeter incisions, minimal soft tissue disruptions, no permanent hardware, which means no plates, no screws, and no pins sticking out of your toes. My hammertoe surgeries take approximately 3 to 6 minutes per toe, and my bunion surgeries take approximately 12 to 25 minutes per bunion. Because these procedures are efficient and minimally invasive, local anesthesia is all that's needed. And for most people, that creates a simpler, smoother, and more comfortable surgical experience. I'm Dr. Lance Reeves with Cool Springs Foot Care in Franklin, Tennessee. If you found this video helpful, make sure to subscribe for more videos on bunions, hammertoes, minimally invasive foot surgery, and recovery tips. And if you have a question about surgery or anesthesia, leave it in the comments below. I may answer it in a future video. Thank you for watching, and I'll see you next time.